Here are some things that I wish I knew before I got surgery for my hip impingement, FAI, and labral tears. Dr. Nicholas Mercer with You Improve PT. So if you haven't heard my story of my journey through hip impingement and labral tear and FAI, I'm going to link that in a video above, in a card above, so that you can take a look at that. But you know that I had surgery to clip the labrum, to clean up the labrum, and to to shave off the quote-unquote extra bone on my femur that was allegedly causing my knee pain. Now, the surgery that I went through, I would say, was probably not the best for my hips. The first surgeon I saw, he told me what was wrong, and I wanted my knee to get better, and so I agreed for him to do the surgery. I was 21, I didn't know any better. After having those surgeries, that same surgeon told me that everything was back. Everything looked the same as it did before the surgery. I went to another surgeon to get a second opinion, and he kind of said the same thing, but what he was going to do is do the same thing. He was going to shave off that extra bone, and then they were going to repair the labrum. Now that I'm a doctor of physical therapy, I have a better understanding of the difference between those two. And there's a few things that I want to let you know to look out for and try before you choose surgery for your FAI or labral tear. Now, again, for me, I'm a physical therapist. Obviously, I am going to think physical therapy is super helpful. There are a lot of studies, however, that show that for a lot of people, arthroscopic surgery may be the best choice. However, it doesn't mean that needs to be the first choice. What I would recommend is, and what I wish I did, was go a conservative treatment route. Now, what does that mean? A conservative treatment essentially means you are getting physical therapy to help strengthen muscles that are weak, move tissues that aren't moving properly, and basically make the hips work like hips should work, or as close to a normal hip as possible. Now, I didn't go through this, and I wish I had, because maybe I would have found some effect on my hips, made my hips move better, and then taken away that knee pain. However, the physical therapy that I had gone to before for my knee pain, they weren't treating my hips, they were treating my knee, and they kind of just focused on the knee. They didn't check out my range of motion restrictions in the hip. And I did have a lot of mobility restrictions in the hip, especially in hip rotation, but they didn't really look at that. They just kind of focused on the knee and wanted to treat that. However, a really good PT will take in everything, right? So if you're having a knee issue, they're going to check the feet, the ankles, the knees, the hips, even the lower back, all the way up the chain, because those all play into our complex human movement system. Now, going back to kind of what a conservative treatment would look like, sometimes conservative treatment includes cortisone shots or anti-inflammatory medications, or some other medications that I don't really have the expertise to comment on, but have been shown to help reduce the initial irritation and inflammation from those hips, so that we can decrease that pain and make you able to do the more complex exercises of physical therapy that maybe the inflammation is keeping you from doing. Now, what happens when you have FAI and labral tears, you can get a lot of irritation in the hips. And if that inflammation and irritation is increasing pain with certain movements that would otherwise be helpful, we would call that unnecessary inflammation, and we would want that to be managed before we improve the quality of your hips, so that inflammation and irritation doesn't come back. Now, through that conservative approach, it is very, very possible and even likely that you won't have debilitating, really, really painful hips, right? I've talked about how a lot of PTs don't really understand and know how to treat FAI, hip impingement, labral tears, especially in people who haven't had it and personally experienced it like I have. However, if we go through that conservative treatment, right, we get cortisone shots, we're trying to manage the inflammation and do physical therapy, and we're still getting that grinding, pinching, overall hip pain in the groin and the front of the hips, that is the time to consider surgery. And what do we need to consider when we are considering when to get surgery? Obviously, the first thing we want to look for is a surgeon who is very experienced in treating FAI, labral tear, and hip impingements. That's obvious. What we also want to look for is a surgeon who recommends conservative treatment first. And the reason I say that is because you know that surgeon has your best interests at heart. They want you to get better. They're not just getting you in and trying to do surgery because they want to do surgery. They actually want to get your hips better. Even better is if you go see, if a surgeon either recommends a hip preservation specialist who specializes in non-surgical treatment of the hip, preservation of the hip, or if you just go see one yourself and get their recommendation too. The more information you have, the better decision that you can make. Now my next kind of advice or suggestion for you, if you have gone through conservative treatment and that is not giving you the relief that you need, is to make sure that your surgeon is up to date on the most recent developments in these types of surgeries, in labral tear repair and basically arthroscopic surgery, cleaning out of the hip. And the reason I say this is because a labral tear that is repaired is much less likely to re-tear or have a re-tear somewhere else than a labrum that is simply clipped off. Okay? So that is one thing that you're going to want to look for, is someone who does an arthroscopic surgery and that does a labral tear repair. We really want to look at that repair because that means we're keeping that cartilage and we're just putting it back in place and making sure it doesn't come back out. Again, I did not have that. Maybe my hips wouldn't have hurt as bad if I did. However, my hips are doing just great as they are now. Okay? So my final recommendation would be, let's say that you went through conservative, it didn't help, you got the surgery, and now you may still be having hip pain, or you may not be having hip pain and you want to keep it that way. Now is where we also want to go through conservative treatment, and here's why. Just because we changed the anatomy of your hips, we made them look more like a standard hip, which again isn't always necessary and is actually something we want to avoid through surgery if at all possible. That being said, we want to make sure that we improve the movement of the hips. Now, there are a lot of things that arthroscopic surgery is going to quote-unquote correct. However, there are also a lot of things that got you to where you are now that are not going to benefit or are not going to change just because you had surgery. One of those is movement patterns. One of them is strength, range of motion, sometimes depending on what is restricting your range of motion, tissue quality, capsular laxity or restrictions, depending on your unique situation. And so we really want to make sure that our surgeon prescribes physical therapy after the surgery. Okay? I've seen this way too many times. People get surgery, their surgeon is just has essentially, it kind of sounds bad to say this, but an ego, and basically says, like what my surgeon did is, you don't need anything after, this surgery is going to completely fix you. And he didn't say that it was gonna make my knee continue to hurt, and also now my hips hurt. And so that's what we want to see, right? We want to see as much conservative treatment as possible, and only when necessary going to actually get surgery and arthroscopic surgery. And then even then, we want to make sure that we get that labrum repaired. Now this is obviously, take the advice of your surgeon. Always get a second opinion from both sides and make the decision for yourself. I don't want to tell you, definitely do this thing and ignore what your surgeon says. Definitely take all the information that your surgeon says and all the specialists and incorporate them into what you truly think is going to be best for your hips. If I were to do it, if I were to recommend it to someone, not knowing the specifics of their hips, I would recommend a labral tear repair. But that is the advice of one person. I would always want you to get a second opinion, even from another PT. So with all that being said, with all those recommendations laid out there, even after surgery, you may not be able to find a PT or the right conservative treatment to improve your hips. And that is why I created the hip impingement solution, which you can gain access to at thehimpingementsolution.com. This is a program that I created based on what has benefited me and what has benefited other patients who have struggled with hip impingement, FAI, labral tears, both prior to avoid surgery and after surgery. Now, what I've done, I've also incorporated my knowledge and skills as a doctor of physical therapy to take tests that I would normally do on a patient who came in with these problems and made them into self-tests that you can perform on yourself, which will guide you to the exercises and techniques that will most benefit you and your hips and your unique needs. It's a very extensive program with a lot of information that will help you in your hips. So please go to the Hip Impingement Solution to get that program. If you're not ready for that, that's okay. You can go to youimprovept.com and get a lot of more free information on ending hip pain. And you can also check out the other videos on our YouTube channel for hip impingement. I will link a playlist above so you can take a look at those. None of them are a magic bullet. There are no magic bullets to this situation. It's more complex than that. And so take a look at those videos, go get the Hip Impingement Solution program, and get ready to improve your pain, improve your movement, and improve your life.